If you didn't see the slide, it's title of our presentation. Let's talk about PrEP, tips and tools for effective messaging. And our presenter is Robbyn Kistler, Senior Consultant with KFF's Social Impact Media Program. Welcome, everyone. So just our workshop agenda. So we will review some of the workshop logistics, introduction to the LA PrEP Project Initiative, our featured presentation, a facilitated question and answer period, an evaluation and closing remarks. And you will have an opportunity, 3 opportunities to win a $50 gift card if you stay until the end of the workshop. You will have an additional three opportunities to win a $50 gift card if you also complete the evaluation. So this is to entice everyone to stick around. So our workshop logistics, use the Q&A function on your Zoom control panel to enter your question at any time during the presentation. You can also use the chat function on your Zoom control panel to share comments or resources with the group. We will also use the chat function possibly use the chat function during the workshop for interactive opportunities. And then our last item, so you can also select the closed caption option on your Zoom control panel to enable closed captions. So participants will be muted and videos will be disabled during the workshop. If you have technical issues, contact Elena Rosenberg-Carlson in the chat. So just a little bit of background about the initiative. So the Equitable Injectable PrEP in LA County initiative is supported by an EHE supplement grant from the National Institute of Mental Health that has been awarded to the UCLA Center for HIV Identification, Prevention, and Treatment Services, which many of us know as CHIPS. The UCLA CHIPS team includes myself as the principal investigator, Dr. Dulara Uskup as our policy and access coordinator, Elena Rosenberg-Carlson as our community workshop facilitator, and Omar Nieto, who's our project coordinator. So this particular initiative is being done in collaboration with the LA County Department of Public Health's Division of HIV/STD programs and our additional community partners. So Bienestar Human Services, Friends Community Center, In the Meantime Men's Group, and the Los Angeles County Commission on HIV. So a little bit of background about why we put together this initiative. So historically, Black and Latino men who have sex with men and Black and Latina transgender women have lagged behind more privileged and well-resourced white gay male populations in receiving information about the latest innovations in both HIV treatment and prevention. As a result, these populations have not benefited from early adoption of these highly effective innovations. And this has contributed to the disparity in HIV that persists today in these populations. So what the initiative is doing, it seeks to address this delay in disseminating information on the latest HIV innovations. And in this case, it's long-acting injectable pre-exposure prophylaxis, or as we refer to it as LAI PrEP, to Black and Latino transgender women and men who have sex with men in Los Angeles County. So to do this, we are implementing a series of online community workshops to provide accurate and up-to-date information on LAI PrEP-related topics that are of relevance to Black and Latina transgender women and Black and Latino MSM consumers and their service providers. So for those of you who may not know what long-acting injectable PrEP is, so its abbreviation is injectable PrEP is the newest HIV prevention option. FDA approved in December of 2021. It's fairly new, and it involves 1 injection every 2 months. To start, you have an optional oral tablet. You can do an oral tablets for 28 days, or you have the option of going directly to immediate injection. So if people can't adhere to pills, they might just want to start with the injection. The injection site is the muscle of the buttocks. And our featured presenter today is Robbyn Kistler, who's a senior consultant with KFF's Social Impact Media Program. And I've had the pleasure of working with Robbyn on other projects, EHE projects in other jurisdictions. So welcome, Robbyn. We look forward to your presentation.
Thank you so much, Ron. Appreciate the warm introduction and the overview of long-acting injectable PrEP, and really appreciate your whole team at CHIPS for inviting me today and for putting together this gathering. You all behind the scenes running slides and audio and letting everybody into the Zoom are actually the most important part of us being able to gather together. So really appreciate each of you and the roles you're playing. Hi, everyone. I am Robbyn. I use she, her pronouns, and I've been a consultant at KFF Social Impact Media for the past 17 years. I don't change jobs much. I've been working on HIV since 2005 and have been affected by HIV for most of my life, including my grandfather's diagnosis in 1986 when I was 12. I grew up in an affirming faith community with a lot of queer and trans people that got hit hard in the 80s and 90s. And I think the first time I cried looking at the AIDS quilt panels was in 1989. So it's been amazing to see how far we've come with HIV and also recognize how far we have yet to go to end the epidemic. And I'm just really grateful to be part of that response with all of you. My main role at KFF is to support our health department and community partnerships. What that means is my day-to-day can look like listening to focus groups or reviewing survey data, following research, and then all that input really helps us to match messages from our Greater Than initiative. We make videos and graphics to the goals and priorities of our partners so we can help reach audiences where they are. A lot of that is on YouTube or in the apps, social media, billboards, radio, more traditional media. Ultimately, our goal is to connect people to local services. And I know from the registration list, a lot of you are those local services, the frontline HIV testers and health educators, PrEP navigators, just critical components of the HIV response. So let me open by thanking you for all that you do on the day-to-day. I know your jobs are not easy. None of the jobs in HIV are easy. It's tough work. And on our end doing messaging, we don't have anywhere to send people if you're not doing what you're doing. So really appreciate the connection that we have in that way. One of our taglines is together we are greater than HIV, and I truly do believe that. So today will be a great opportunity to show what's possible when we all join together. We have a huge group gathering today. So let's see what we can do and work interactively to come out of this and make a difference in LA County. We have a pretty straightforward agenda for today. I'll be asking for your active engagement in the chat throughout. I see some folks are already joining in. Let's just try to keep this as interactive as possible. I really wish we could be in the same room and see each other's faces. I'm in my kitchen talking at a screen, and I wish I could see all of you. Since I can't, it would be great if you would participate in the chat. I see some of you are already introducing yourself. If I could invite everyone else to do that as well. Your name, the name you like to be called, your organization, and your choice, either the part of the county that you serve or your favorite food, or both, just to get this chat hopping. So like, what do you like to get on your birthday, or something to eat that always brings you joy? Mine is raspberries. I think because I'm a June baby, they're coming ripe. I don't live in California, you could probably tell from that statement. So I would love to see what your favorite foods are, where you all are coming from. I see Sophie in Orange County, TJ also in County of Orange. Good morning, Raphael. Looks like you all are coming through. Nobody's giving me any foods yet though, so I'm gonna check back and see what y'all are eating. So diving in, we'll use the chat function. Please feel free to anytime, drop your thoughts. I'm going to show some videos, and it would really be great to see as you're watching them, anything that stands out. And I'll ask you after a few of them what stood out to you and some of the themes we're going to look at. But if you have a question, please make sure to use the Q&A function, because I think the chat will be pretty active and we'll lose your questions. We may lose your questions if you don't use that Q&A function, which will allow us just to keep a focus on that. So chat as much as you want, Q&A for things that we'll address at the end. And then on the agenda, I'm just going to spend a little time talking about effective PrEP messaging themes that we've created, show you some examples to try to get everybody's juices flowing a little bit, and some key approaches that we suggest as everyone works together on informing LA County about PrEP, including the long-acting injectable. And then at the end, and remember, you get entered in the raffle. If you stay at the end, I'll try to make that as painless as possible for you. I'll share some free, absolutely free, like free 99 resources that are available to you from KFF's Greater Than initiatives, the videos and graphics I talked about, and some other tools you're welcome to use to support your own local outreach. So between now and then, really invite you to participate actively and take notes. This is your time. Make the most of it. I hope that you come away with at least one concrete next step that you'd like to take. You'll see we talk about calls to action as being part of a key message. So make sure at the end you're able to articulate for yourself what's one thing that you're going to take from this presentation. Maybe you're the person who's going to have a whole entire work plan out of this, but I'm just asking for one. One is completely passing. And then we'll check back in on that at the end. All right, so that's our plan for today. For anyone who isn't familiar, let me introduce you to KFF. We're an independent nonprofit. We provide health information, so really focusing on being a trusted resource about health issues in the United States. You may know us by our older name, Kaiser Family Foundation. We go by KFF now. And because of that, Kaiser folks constantly think we're Kaiser Permanente. We are not. We don't have any clinical services. If you go to Kaiser for your healthcare, that's not us, which is a funny thing. It's just commonly confused. So we are not prescribing PrEP here. We're providing information. So I wanted to clear that up. And the program at KFF that I work with is called Social Impact Media. We work with health departments and community partners as part of our Greater Than public information initiative. So everything comes out under that brand, Greater Than. And primarily our focus is HIV and sexually transmitted diseases. We include MPOX in that. We have some messaging that we can talk about at the end if you're interested. But we'll focus today on PrEP. And I work with this very small but mighty team at KFF that develops all our campaign messages, maintains our website, which is greaterthan.org. And we have social media accounts. We have about 500,000 followers at Greater Than HIV across all the major channels. And then we coordinate partnerships with folks like you. So that's part of why, especially for those I haven't connected with before, really glad to be here together. Other programs at KFF also inform the work of our messaging, like our journalists with KFF Health News and our polling team that has conducted national surveys about knowledge and awareness of key aspects of HIV, including PrEP across the country, and also on intersecting issues, the impact of racism in health, understanding trans identities, immigrant experiences, health coverage, and much more that directly relates to the work of this collaborative. So all of those resources, the news and survey, are at kff.org. KFF's Greater Than HIV, as part of the initiative I mentioned, provides the latest on HIV, STDs, and other pressing health issues, MPOX, and other things that emerge. Recent years have given us new foci, that really we're working with disproportionately affected and underserved populations, the groups that Rhonda identified earlier. We work to reach those most affected with the latest on testing, prevention, and treatment. So we're going to talk about PrEP today, but it is a full circle, status neutral campaign with information for folks regardless of status or whether they know what their status is. We launched this campaign as Greater Than AIDS in 2009. And before that, we had spent about a decade producing HIV messaging in the US and other parts of the world, including Latin America, the Caribbean, and others. So some areas that have some strong intersections, particularly for populations in LA County. In all of the time that we've been working all day, every day, Black and Latino and Latina MSM and transgender women have been key populations for our work. So these are groups that we know well. And we localize our campaigns. So we're a national campaign, but we localize campaigns to address community needs. Some of you may actually know us from partnering to test at Walgreens on National HIV Testing Day, which is June 27th every year. We've done that since 2011, and we are really grateful to the health departments and CBOs that staff those events. Walgreens provides the space, and groups can choose stores that are in locations that are maybe underserved or sort of high traffic, good places to be offering testing. So I just want to shout out those of you who signed up for 2024. I saw Pasadena and Altamed were on our lists, and thank you for doing that. If others are interested in offering free HIV testing, you need to provide the staff and the tests. You can also do Hep C and syphilis rapids too. Let us know right away because that registration is technically closed, but just in this idea of ways that we work in the community, we would welcome more stores activating in Los Angeles on June 27th. I'll put up contact information at the end, but you could also email us at community@kff.org. A little plug for that, community@kff.org. We can go to the next slide. There's actually a picture, I believe, of Watts Health at one of the HIV testing events. If you look in that lower center a couple of years ago, and we work with hundreds of partners like Watts to offer free testing as well as information about PrEP and treatment across the country. So this could be your one action that you take out of this call. But that is just one of many ways you can see on the slide. We have been messaging about PrEP since it was approved in 2012. Obviously, at that time, it was only a pill. We have more options now, part of why we're here today. And we've done lots of focus groups with gay and bisexual men, transgender women of color, and we've interviewed many people on PrEP. And we really keep an eye on the continually concerning trends that Ron outlined, the disparities in uptake, and are always trying to keep our finger on the pulse of the information needs that are barriers to that uptake, because information access, just like housing and poverty and health insurance, can drive disparities as well. So part of why we want to talk about messaging today is to make sure that communities have information to make choices for themselves. So you can see in these images, we're often coordinating through local health departments. Sometimes we'll co-brand for media placements, and then also to distribute information on the ground. So events and flyers, things that you can use in your public education. We work with partners at all funding levels. That includes the $0 funding level, the free funding level, but also large scale campaigns to localize media messages and community materials, as well as to place ads. I think that's why Ron invited me, because we've been doing this PrEP messaging for many years and have spent a lot of time thinking about what are sort of key needs around information related to PrEP. Anyway, if you have a budget to place billboards around LA County, or you want to do digital ads focused on these groups, we should talk, let me know. And we can also provide personal face-to-face outreach tools that we're going to talk about today. So you are in the right place if you're a health educator doing outreach in the community, or counseling and testing, all of those roles, PrEP navigation. There is, as you can see on the slide, there is no one single PrEP message that is a fit for any community. It was actually quite a challenge to put together today's presentation, because we could talk about this, and we have been talking about it for years. We could certainly spend a whole day on it. So, it really depends on goals, what we're trying to achieve, the audience, like who specifically we're trying to reach, what do they need to know, the landscape, what others are doing out there. And of course, what resources are available. So my first tip for effective audience-focused PrEP messaging is to make sure that you've made a plan and you've answered some really basic questions to define your goals and audience. And this is true whether you're headed out to a club to chat up folks about PrEP, or you're planning a TV buy. You really need to be specific about what you're trying to do with your messaging. There's just think about PrEP, there are a lot of different aspects, right? Is it that, oh, we've got injectable PrEP now at our clinic, we want folks to know that? Or is it some of the stigma around HIV and PrEP that you're trying to address? Those two messages have different objectives, would look quite different. And then who very specifically is your audience? This initiative is focusing on MSM and transgender women of color, but that's a lot of different people with different needs. So breaking that down, are you talking about all of those people? Are you talking about specific age group? Maybe those who speak Spanish? Maybe some, would have different priorities around, I want to know about hormone replacement therapy and PrEP, or I've got sort of other issues that I need to get taken care of, food and housing, before I can even consider something like PrEP. So within each of those groups, just being very specifically clear about the audience that you're aiming for. And then we need to think about the placements. Where's this thing going to go? Is it, 7 words on a billboard? Is it something I can print on my printer in the office and stick up in the restroom, sort of, or is it a video where I've got sort of more time and, opportunity to convey more? So those are important, and how many other people will see them in addition to my priority audience is also important, because we don't want to do anything to add to stigma and burdens that communities have by messaging more broadly in ways that can be detrimental to the communities that we're trying to partner with and serve and lift up. So be sure that you can state all of these, your dissemination strategy, your placements, your audience, and your goals, and then really think about what's the role that you are playing in messaging specific to PrEP. So remember that our communities are seeing messages from the pharmaceutical companies, messages from Greater Than, messages from the health department. So what is it that your piece can be on your social media or, you know, out at a club talking with folks? So really think about these pieces. And now we can talk about what goes into the messages. We could have many more webinars just on campaign planning or, you know, sort of broader things, but the root of this and the next half hour or so, I'm going to talk about what goes into the messages. So there is not one size that fits all, I've said, when it comes to a PrEP message. We can talk for days about this. So the way we've tried to structure this presentation today is to think about themes that should be considered across all PrEP messaging, whether it's specific to the pills or shots. And of course, there are some things that are specific to shots, whether we're talking to MSM or transgender folks or all of the above, broader community. And actually, most of this can relate to other populations too. So we're going to look through the lens of the groups that the CHIPS team has identified for this collaborative for the next few minutes. Let's go to the next slide. So these are some more examples just to give a sense of some Greater Than HIV PrEP messages. All of these, I believe, are actually made for digital placements, so banners in dating apps or on Facebook, Instagram, YouTube. And you can see we've taken a mix of approaches. So some of them are graphics where you just see words. Some have real people from the community. And some of those real people are trusted healthcare workers. So these are, and all of these folks reflect communities that are most affected by HIV, other than the blue and white words. I don't know any blue people, but you can see that we're reflecting the community in the messengers and the messages. And these are all strategies that we've used. So just thinking about how to convey information, some ways that can be helpful to think about that can help to reduce the stigma around HIV and deliver effective information. You can also see not just the who, but also differences in how we're delivering the message and what the messages say. So we are mindful that different people are in different stages of relating to PrEP. Even if we take just one priority population, let's say we're talking about young Spanish-speaking MSM. Some still don't know about PrEP. Some have been on it before and stopped taking it. So those are different approaches, right? Sort of what PrEP is and help me understand why'd you stop taking it? Maybe that's still the right choice for you. Do you have questions? Did something happen? Are you aware that maybe there's some other options? So just a whole range of experiences. We should be keeping in mind that our audiences are not all in one place, and even the same person may shift among sort of messaging needs and desires around PrEP. So we want to make sure that we're reaching different places. And then remember too, in these communities, a lot of folks are already diagnosed. So we want to make sure that our messages don't add to the burdens and stigma of people living with HIV either. So as we think about the range of messaging to our communities, we can think about basic information, sort of what PrEP does. PrEP prevents HIV. Maybe that feels obvious to all of us on the call. We're working in the field, but our audiences are not spending all day thinking about HIV. It never hurts to start from the beginning. What PrEP is, what it does, literally that it is a medication, a pill or an injectable that prevents HIV. And that phrase PrEP prevents HIV also has a secondary message, which is that PrEP is effective. It works to prevent HIV, and I mean, like, it really works to prevent HIV. And that is a top question we know many in our communities have, like, does it even work? Is it worth it? How well? So making sure that we're working some of that in. Some of the other messages here, like, why not take all the measures you can to stay healthy? That's Tiana. She's a Black trans woman in purple. That's more about the benefits of PrEP, sort of the positive side effects. Or in Spanish below, Brandon is saying they feel less anxiety on PrEP. Or Lex, it gives him hope for the future. Those are all reasons to take PrEP. And then more specific aspects, folks may have questions about injectable, what about injection drug use? What about interactions for HRT, hormone replacement therapy? What about mental health medications? You know, there are specific health questions for individuals. Or just the most fundamental, which is where can I get PrEP? All right, I want it already, but like, I mean, particularly around the injectable, where can I get it? I know y'all have been working on that as a community, but that's the most common question is where? Where can I find a PrEP friendly clinic? So the takeaway from this slide is there are lots of ways to message about PrEP, lots of facets to the conversation, and a broad set of needs for information, both on the facts and on the feelings related to PrEP. Let's break this down a little bit more. Quickly going again into the basics of PrEP. I just want to make sure that I said there's never too many times we can review the basics, right? So most importantly, it is a prescription medication. So that cues that you're going to have to get at a pharmacy. I know y'all in California have some good options about pharmacies, which is awesome. And then it is for people who are not living with HIV. I have had, like too many people say I'm undetectable, I'm on PrEP. So you can't have an undetectable viral load and be on PrEP, right? You can be on other medications to treat HIV, but it's just an indication of the confusion around PrEP is for people who do not have HIV. So that's always worth underscoring. And it's available as pills and shots, and there is help available to pay for it. So a lot of news articles and community conversations, think about what you've been hearing about PrEP for the last 12 years. It's expensive. Oh gosh, it's just, you know, crazy expensive, and the injectable is super expensive. But insurance is supposed to cover it, including the injectable. And I know that process is not always as smooth as we'd want it to be. And of course, I'm navigators on the call. You're like, you know better than I do. There are programs for uninsured to covered meds, and sometimes labs and visits for free. So we want to address those real issues that are potential barriers to our communities that are less likely to be insured and more likely to be lower income. And then I said already, I think where PrEP is available. There are directories of providers. You may be referring folks to your own clinic. So just making sure. So these are sort of fundamental starting place PrEP basics. So I'm going to take a sip of water and show you a video real quick that just addresses, it's like the top line common needs that all communities can benefit from regarding PrEP. We could play the video, please. Omar, we don't have sound, which is okay on this one, but there is a music track and something that we'll want to make sure we have sorted for the next ones. Give us 2 seconds.
So Elena, if you're online, I do want to note that I'm not able to share my sound. I think you might have to re-enable sound so that folks can hear the audio.
I'm going back to check everybody's food. I see Chinese food, Mexican food, sushi. Oh my goodness, it's getting to be lunchtime. Steak and potato with wine, chocolate cake. I'm getting very hungry. Sorry, buddy, give us 2 secs. All right, here we go. Let's just let it play. We're not getting the audio, but you can see. And actually, this is a great example. So a lot of times folks will be watching a video like this on a bus, or, you know, you're sitting on the couch and the TV's on, so you don't have your sound on your phone on. So this is actually designed to work. It's available as a pill or injectable. PrEP requires a prescription. And this is the part about paying. There are options if you don't have insurance. And then we'll talk a bit more about this, just where to go. So how do I get it? Where do I go to get more information? I got questions. I'm not ready to get on it. I want to find out more. So we will need the audio for the next video that will come up too soon, but hopefully we can figure that out as I'm chatting through. So those are the basics. And I've got 4 other kind of main constructs, themes that we want to talk through. Let's start by looking at ways that our messaging can be trustworthy. So we know that medical mistrust, just general trust of our clinics and our public health system is not high. So we need to do what we can to help increase trust, particularly for communities that have been mistreated or excluded from the healthcare system. Last week I was at an event where the theme was healthcare moves at the speed of trust. So just hear that, healthcare moves at the speed of trust. We are not going to help folks find their way to injectable PrEP who want it if we are not putting out credible information, believable, trustworthy information. So really critical that that's at the heart of anything we do. So how do we do that? This is about who is delivering the message. So literally, who is handing me a flyer? What logo is on it? What's my association with that organization? Which person, which of you, or what organization is posting it to social media? Do I trust the source? Like, why should I believe you? And then also, who, if anyone, appears, if there's, a message, it's a poster or a flyer, I'm going to show a video. Are they a community member that I know? Do I know that they walk the walk or have any reason to believe that they don't? So trust is in who, and trust is in how. How is this information getting to me? Do I feel like you're just trying to sell me something? Do I feel like you're taking my concerns seriously? And are you just telling me what to do versus giving me options? I think this is really important on injectable when we talk about sort of presenting information about injectable versus pill. Some folks are only going to have access to the pill. So we want to, and both are, and some people would prefer to take a pill or don't want to go to the clinic, every 2 months. So being mindful that we're giving people choices, I think, is an important part of this trust. So I think we could go through some of the clicks. So relatable messengers and in terms of who you feature. I mentioned before, real people from the community, doctors, other health experts, even in communities of color, where there is, of course, medical mistrust. Healthcare professionals are still the most trusted sources of health information. So especially if they come from and look like communities that we want to reach. I'll show you some examples. We want to have honest conversations that the messages are really acknowledging reality, whether by sharing personal experience or keying into what it's actually like to start PrEP. We want to be non-judgmental, especially for queer and gender diverse communities. It can be helpful to signal it's okay to talk about sexual health, your sexual health with us, that this is a space you can expect to be treated with respect. And then of course we need to make sure we're following through and that we are providing spaces that treat folks with respect, that your identities are safe here. And the more open our messages are, the more we can create safer spaces for open dialogue. And then we just need to be responsive to needs. That cuts a lot of different ways. We're talking about answering common questions, acknowledging that questions are legitimate, really keeping the dialogue open and not being dismissive. So I've heard in focus groups that folks are skeptical because PrEP is 99% effective. That's not 100%. And that 1% is the hang up. So let's talk about that. Let's understand what that risk reduction means, and really sort of understand where those numbers come from. So let's see if we're going to have some audio on this one. Good news, they are captioned if not, but I'd love for you to be able to hear Michael's voice. The picture you're looking at is Michael, and he was an early PrEP adopter. I think he's been on a month or so ago. I think it's been like 7 or 8 years. He was a PrEP navigator in Atlanta, and before that in New Orleans. And he now works for PrEP for All, which is sort of working on advocacy for pricing and access for PrEP nationally. I'm saying all of his background because those are some of the credentials that make him a trustworthy messenger. He really knows his stuff, and I think it shows. And I'll let you be the judges. Let's see if we can hear him.
I've always been anxious about taking an HIV test. If I slipped and either didn't use a condom or had sex with somebody who I didn't know their status, it would definitely frighten me. The messages about HIV were there, but I think somewhere in the back of my head, it was still, I'm not really at risk. I have to start being honest with myself, really assessing what my risk is, not so much as behaviors, but because I'm a young, Black, gay male, I need to take this extra level of protection because I am at risk. That's a hard phrase to say. The first time I heard about PrEP was when I got an STI screening. As far as how effective PrEP was, I was sold on it pretty shortly after I found out. It removes that anxiety. I can actually approach an intimate interaction and not have to worry about what my test results are going to be. Now I can embrace my sexuality, embrace my ability to be intimate with another person. It's more about me taking control of my health. I'm not running around trying to shove a blue pill down everybody's throat. They'll always just tell people, look at what being on PrEP can mean for you and decide what you want to do. For more information, go to prep.greaterthan.org.
So that was Michael. Here's a chance to hop in that chat again. I would love to know what you all thought of that message. In particular, thank you for the hand claps. What do you think he did that made him seem trustworthy, if he seemed trustworthy to you? Give you all a second to hop into the chat. Honest about his own story. Appreciate that. His personal experience, sharing his story. Oh, that's interesting. All three of you, that's his own story, personal, right? Sort of those pieces. He's knowledgeable and credible. He's sharing. Exactly. So you kind of get some of the ideas. He shared his identities, right? Some of the cues to being a same gender loving man and being part of the community. He's talking from his own experience, not acting judgmental. You're getting it. Exactly. Exactly. Okay, I've got more to show you. Keep those comments coming and I will come back and read them. I want to make sure that we see our next trustworthy messenger. Oh, the other thing he said, I'm not pushing a blue pill, right? He specifically named that thing that folks are concerned about. I thought that was also important. The next messenger I want to show is both community member and a medical provider, a healthcare worker. Let's take a look at David and see what y'all think. Keep your comments coming on Michael and pay attention to David if you can do two things at once.
I'm Dr. David. I'm your HIV doctor. PrEP is pre-exposure prophylaxis. It involves either some kind of medications, whether it be a pill or injections, that someone who is HIV negative can take in order to prevent getting HIV. So for me, PrEP is such a great option. I was one of those people that I could sometimes use condoms, sometimes I wouldn't use condoms. If I look back, if I could speak to a younger version of myself, because back in 2007, I tested positive for HIV myself, I would have definitely taken something like PrEP in that day because I knew it would have helped me to prevent getting HIV. Of course, now, living with HIV, being on medications, being undetectable, that's what I'm doing right now, and I have to move forward. But you have an opportunity, if you're not living with HIV now, to actually take advantage of a lot of the biomedical advances that we have. I didn't have the benefit of those biomedical advances back in 2007. Do I wish that I had? Absolutely. Am I still living my best life? Absolutely. But if you have the options in front of you, make sure you exercise them and never let anyone talk you out of getting PrEP if you feel you need it.
All right, what y'all think about that one? Up in the chat, please. I just think he's so awesome. It's like a hero in the community to me. It's a workplace hazard to fall in love with all the people we get to work with. He's amazing. While you're adding in, I see that he's very open and honest, sharing his story, not pressuring folks to get on PrEP. I think this idea of generations and voices of people living with HIV are really important to conveying sort of, if I had had the option, just kind of showing the opportunity that that presents. I'm sorry, I'm starting to read it. He's open, he's honest about his experience. He's assertive, but also humble. He spoke out about his own truth. He's an incredible educator and advocate for HIV care. If you feel you need is the key. Oh, I love that, Anthony. So just being open to like, it's somebody's choice. If you feel you need it, if this is something that you want, if this is sort of relates to you and that intergenerational kind of piece. So you're getting the themes of trustworthy. I would also say that David's message, I mean, all of these themes actually for everything that I'm showing you could be said about any of them. So it's really just a way to kind of think about messaging. So he is also engaging, right? Like sharing his own diagnosis, coming across as he is an incredible medical doctor, catches your attention too. So Let's go on to our next point, which is about ways that we can make sure that our messages are engaging. There's a lot of different ways that we can think about this. So thinking about how a potential client can get information that will stick with them and also kind of have like an emotional connection. So the information is important, but also there's a sense of uplifting people, not scaring them or causing more stigma. So showing personal benefit, I think the chat was popping in both cases, right? All about personal, personal, personal. It gets your attention because someone's telling, like, sharing of themselves, but also because it feels relatable to you as the viewer and has some value to you. Whether you're considering PrEP or not, it's intriguing, it's engaging. It's empowering and hopeful. Our team at KFF really doesn't believe in fear tactics. They don't work for HIV messages, in our opinion. And of course, the diagnosis can be scary, and we acknowledge all of those feelings. But we as humans may be more open to listening and hearing and taking in information when we're not in that fear-based space. And I just don't know of any way to do a fear-based message that doesn't also add to a pile of stigma and discrimination against people living with HIV, which of course is not something that we would ever want to do. It's not helpful. The next point is to be engaging is appealing to both mind and heart. So this kind of facts, information, as well as emotion. So we make decisions not just based on how much we think something costs or whether we know about it, but also these feelings of, oh, I might be more confident, more comfortable, I might feel healthier on it, right? Sort of these positive kind of heartstrings tugging. And then this idea that it can fit media platforms is the last one. And this cuts a bunch of different ways, like literally that it fits, it is the right size for where you're putting it, that, if it's a flyer, you're not stretching your logos, or that, you can convey what you want to convey in it. But also that it reflects, let's say you're at some venue, posters tend to have a particular style, right? You want to stand out enough to like folks see your message, but you also just want to make sure that it fits the space that it's in. And this is true on social media too. So, or a billboard, like you can only put like 7 words on a billboard, or you're going to miss, nobody's going to see anything because it'll be too tiny. So really just thinking literally about the format that you're in order for it to be engaging. Folks have to see it, or to be able to take it in fully. So I have 2 more videos to show you. Feel free to jump in the chat as you can, and also take time to watch. I'd rather you watch and take it in than and then share your thoughts. So the first you'll see is really fast and catchy. It's captioned so you can digest it even if your sound is off. And it's an example of designing for today's vertical formats where we get just a couple of seconds of somebody's time before they maybe swipe along. So I'm talking about TikTok and Facebook and Instagram stories and reels, maybe YouTube shorts. And let me just say before we watch, and we'll talk more about language in a minute, but this is a Spanglish message, so a mix of Spanish and English. You'll see he's speaking in English and the graphics are in Spanish. So this is an example. We also have it English and English, so English captions when he's speaking English. But I wanted to show this one as a way of knowing Latino MSM, that many do and many don't speak Spanish. So this is kind of a bridge message that if you're putting it on your social media, regardless of the language ability of somebody who sees it, there's access. So just working for a mix of people and kind of meeting those 2 prongs, since you can't always control exactly who's gonna see it. So we would put it in a mix of posts with English, and then we have others that are fully Spanish too. So enough on that. This is Brandon, who uses they, them pronouns. Check them out.
Comes down to like, do I like this person? I think one of the big things is like being proactive about your healthcare, which is what PrEP is all about. PrEP is this pill that you take once a day to prevent HIV. PrEP makes me feel like I am able to take my health into my own hands. It gives me a lot less anxiety.
So super quick in there, you get a sense of like the empowerment and hopefulness. There's a little for your head, a little for your heart. He says what it is. Let's go ahead and play the next video too, and then we'll take your comments in chat. Feel free to drop in whatever you thought about Brandon. And I also want to introduce you to our next ambassador.
I had never got an HIV test. So I was nervous. When it came back negative, I was happy about that. My doctor was telling me that transgender women are most likely to get HIV. He asked me, would I like to get on PrEP? PrEP is a medication that prevents you from getting HIV. It put me back in control of my own life. I used to not date anyone and kind of stay to myself, but I've been dating more because I have the extra security with PrEP. It just feels good that I could just get out there. It made me stronger, a stronger woman. For more information, go to prep.greaterthan.org.
So that's Nicole. She's a trans woman from New Orleans, and you can just see engaging in a different way, right? Again, this kind of personal story, but an example of how that can have some of those same themes of being trustworthy and in a different style that's sort of engaging and trustworthy. Any thoughts about Nicole and Brandon's messages? I see a comment from Carrie. Oops, sorry, it's popping around. Let me go back up. About Brandon PrEP taking health into my own hands and having less anxiety, that kind of key piece of engagement. And Carrie, it was specific to pills. We made those before we had an injectable option, and some of our messages, and it is still, of course, pill, but we'll be adding with more injectable profiles as more folks are on it. Made me a strong woman. That's really beautiful about Nicole. She's more engaged and out there because she feels protected. Anthony, I'm just reading. We're told our whole lives we can't do this, we can't do that, we can't express ourselves a certain way. So any language that further restricts our autonomy when we fought to get to that place of reclamation is a reflexive deterrent. Any language that speaks to expanding personal autonomy is going to resonate more. Well, I'm done. Yes, 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 yes. Beautiful. Thank you for sharing your comments, and others who haven't chimed into the chat, feel free to pop in. There's no time limit on it. I'd love to know what your thoughts are. So let's move on. I've got two more sort of themes of messaging themes. One is about making sure that our messages are accessible. And this is, again, back to this, literally, can the audience understand it? I'm talking about language. So we talked about English and Spanish, but also, can I read what you want me to read? So if you don't speak Spanish and can't read the image on the slide right now, other than the first word, you probably get that it's about PrEP. Being on this webinar was another good contextual clue, but if you can't read these words, that's how our monolingual Spanish-speaking neighbors experience an English-only campaign, right? So we have to design for our audience, and a key aspect of reaching Spanish-speaking MSM in LA County is going to be around language. And then regardless of English or Spanish, are the words simple and clear enough for the average person to understand? So we're talking about word choices. Do we want to say long-acting injectable? There's something in that long-acting that's oh, it's got some duration to it, right? It may last a while. Or do we want to shorten to shot? Do we have space to say long-acting injectable? Does our community understand? Literally, are there literacy barriers being able to read those big words? And then the name of this webinar is LAI, short for long-acting injectable. I would wager most of the community has no idea what LAI stands for, and other acronyms. HIV too, right? We just have all sorts of acronyms that we throw around because we talk about it every day. Let's make sure that our language choices when we're putting out messages are really accessible, plain and simple. If you do want to introduce the community to new terminology, so like long-acting injectable, or you saw in that first video, we did it with pre-exposure prophylaxis, so explaining what PrEP stands for. Huge words, most people don't know until you sort of break them down. It can be helpful to introduce them, but make sure that you're providing that explanation. And then on the visuals, do they speak to the audience? Is it dark red and it's in a dark space on a black background, literally I can't see it? Are your photos so pretty and cute? And I have seen some gorgeous campaigns that I can't tell are about PrEP because it's not you sort of get lost in the imagery, which is lovely, but what is even it saying? What's it about? Is the point coming across through your visuals? Are they reinforcing? And this goes back to kind of fear of needles. We generally choose to use a vial or a Band-Aid, not a big long pointy thing. making sure that visuals aren't adding to fears that folks have, and also provide a visual explanation if the words are hard to read, that those are all complementary. Size, I know this sounds basic, but for the placement, I mentioned billboards, like, am I able to take this in a drive-by? Are the colors readable? Is there enough color contrast for me to be able to see? Some colors can be really distracting from the message. Where possible, adding voiceover. You saw when we didn't have sound for the first video, how it can be helpful to have voiceover and subtitles for those with hearing differences. Think about folks who may want to watch a video with sound off, the example I gave, like on the bus or on your couch or something. And then this is super basic too, but it's so easy to miss these marks when you're thinking about everything else and putting together messages. That's, even talking points when you're going out in the community. No jargon. So we talked about LAI for long-acting injectables or the shots of PrEP. I think another example specific to California would be the PrEP app or the assistance program for PrEP. Our community members don't know what PrEP app is. They don't necessarily need to know what that it is unless they need to be able to Google it, but they just need to know that there's help available to cover costs, right? So think about language, the simplest, clearest, easiest to understand language. So folks know they can get PrEP for free. That's kind of bottom line. One way to test all of this is to have some community members take a look at your messages. It's part of like your feedback in the chat for us is always helpful, so we can do better next time too. But making sure that you're showing to folks who are sort of intended parts of the audience and see what they say. Okay, last messaging theme. We want to put out information that is actionable. And what we mean by that is that there's a clear next step. So you've seen ours are usually going to a website. We're sort of national, so we're referring people to a website. You might refer people directly to your own website or a place to get questions answered. Come talk to a navigator. We want to make sure that we're at the same time helping folks find pathways to overcoming common barriers. So where can you find more information? How do I get my questions answered? What's nearby me so I can connect to local resources? Most people are going to have some questions before they decide to take a medication for a chunk of time, right? Like we need to be aware that we are, folks have come in that space of sort of consideration and meeting them where they are in the stages of change to provide that information. So a few more thoughts about referral resources. So the idea of like the website or the phone number that you're giving. Before you put anything out, let's say a phone number, try calling it yourself. You would be amazed. I did this yesterday. It was for a testing program in another state. And the place I was calling said, oh, no, we don't offer that anymore. So like you have to call and pretend that you're somebody who saw your message or is like responding to your outreach worker. Let's say that you gave out a Spanish message and they call the number and the receptionist doesn't speak Spanish. They did the big thing of taking the step and we lost them, right? Like we failed them as an HIV response. Or can I get a PrEP appointment? And the person on the other end doesn't know what PrEP is. So just all of the pieces that make sure that this is as seamless as possible. Does the website load nicely? Does it show up on the phone? That's going to be the way that I'm going to see it because that's how most folks are accessing the web. Does the person on the other end of the line greet me in a way that I feel welcome and well treated? So, what can we do to shorten the pathway for folks, I guess is kind of the bottom line. So, maybe there are a couple of different phone numbers. Maybe it's possible to have a clinic phone number or an agency phone number that can be texted. I mean, my 17-year-old sure does not want to pick up the phone for anything. Like it might be 11 o'clock at night. Like what if I could just text when I'm in the moment? And even if somebody can't get back to me the next day, that referral resource is accessible to me in a way that works. And, ideally somebody who can relate with me. If we want to reach trans people, let's have trans people on the other end of the lines. If we want to reach folks who are Spanish speakers, let's make sure that we've got fluent folks on the other end of the lines and really try to make sure that those that we're promoting the very best resources, the shortest pathway to getting to PrEP, because I think sometimes we get in the way of our community's access to. Okay, last section of the slides. This is a great time to pop questions you have into the Q&A. And if you haven't already made note of at least one action step you want to take after the presentation, start jotting down your thoughts. You are the folks who can make PrEP more accessible in LA. So be sure to use this call to think of one new way that you want to do that. So remember at the top, I said everything you see today is available for free, free 99. These are all resources you can use. Let's maybe go to the next slide. I've just shown you the tip of the iceberg, really just a sampling of a few things that we have available. And I want to talk you through some specific ways our partners have shown us that they're using greater than HIV messages. And then I'll close by telling you the websites where you can find all this good stuff, and we can get into Q&A and the raffle. So this is a photo of Dr. David, who we just watched. You can play videos anywhere. So you can show them in waiting room. This is intended to look like that. Or on your phone in a one-on-one consultation with clients, just pull it up and like, hey, look at this. Have you seen this? You could pass along, like, here's a link, maybe watch this, maybe get your questions answered in the playlist. Train your staff or bring it to a staff meeting with your peers to talk about how could we maybe use these in the field, or use watching the videos for us as a group, our team, to have a conversation about what are we seeing out in the field, what information do folks need, and how can we help get them that information. You could put them on a big screen at a ball or a drag show. If you've got an MC, like, sort of use these to help guide some of the talking points. We've had them in movie theaters for Pride Film Festival. So y'all know your community, where folks are, put them where the people are, right? So think about how you can get these videos onto screens. You can have the video for free. You got to find where to place them. And again, it can just be as simple as carrying it around in your phone. And if you don't have a screen, print out a QR code and tape it up in the bathroom screen, right? Like, there's just, get creative and think about if I like this resource and I think it's a good fit, how can I get it up to my community? The next is also a free 99 option, pulling it into your website. I suppose you do need a webmaster. If you're paying your webmaster, there's some cost of their time. I am not a webmaster, but I am told that you can just go into YouTube, copy the embed code, you right click, and just like you were going to share it, you can copy the embed code and then paste that into your web code. And ta-da, you have just kind of zhuzhed up your website. So these are two examples of the Idaho Health Department and a newspaper pulling in the videos to add information, add personality, and convey information about PrEP. Totally free, just cost your time. Similarly, anything that you're emailing out, these are formatted newsletters from Virginia and the National County and City Health Officials Organization, but you can just hyperlink or paste the link to a video in an email or in a text message. Any ways that you are communicating with your clients, with your community, with event goers, add those in, and you can just email it out. Again, super, super cheap and easy. And then let's take a look at a couple of social media posts. These are several different examples just to show how you can absolutely customize a message with your own text. So on Facebook or Instagram or wherever you're posting, these pull in a phone number or an address, kind of those next steps that we were talking about. So each of these groups didn't spend time and money on the visuals for these posts. They borrowed ours and made them their own. Nations is a trans-led organization that promotes their PrEP Navigator's phone number. So again, shortening that line. The Baton Rouge example added 99% effective rate in their post, and they have their phone and web info, and we appreciate that they tagged us. That gives us a chance to help amplify their post. That's how it landed in this presentation. So if you tag greater than HIV, then we'll know that you're doing it, and we can help amplify it across our social too. And then Sister Love UC linked to their PrEP resource, and they also said how to get a self-test, which of course is the first step towards PrEP is taking a test. So an actionable, like, let's get you started with this piece. I also just want to point out that there are two cisgender women on this slide. Nothing about those messages makes them irrelevant to Black and Hispanic MSM or transgender women. Know your audience's needs and consider that the messenger doesn't always have to look like the audience or share the same lived experience. If the information is relevant and the messenger is trustworthy, engaging, accessible, those can be effective messages too. Sometimes they can help lower the burdens communities most affected by HIV can feel when they're the only ones shown in HIV ads. So if we know HIV can affect anyone, our messages could reflect that too. even or maybe especially when we're aiming to reach underserved communities. So I think this is also helpful to see how you could build out your social media calendar with a mix of messages. So we have so much content. You could post every day for the rest of the year and have something new each time. So define your goals and audience and then pick which messages you think best fit your audience's needs. Okay, couple more minutes, just a couple more examples. Can never get enough Dr. David. But just to show, these are the same video, the one that we watched, but two different examples of folks using it. So the CDC posted it, and Cobb Douglas Public Health, they're in Georgia, posted it. They made it their own. So see how when they put it on their own social accounts, they're co-branded essentially because it comes out under their profile, right? So they're posting on their page. It has their logo in that little circle that appears by it, their profile pic. So your followers don't need to know that we made it. None of us have enough resources to do everything. So borrow from us anything that you can use that will help you. And also notice these have campaign hashtags. So if you have a campaign that you're running, CDC's is Stop HIV Together and Cobb's has Stop HIV TL, Atlanta. For no cost, they expanded their own campaigns, right? Just grab a video from us, put their own hashtag on it, boom. It's part of the other messages that they're putting out under those campaign hashtags and slogans. So if you have a slogan you love, something local LA, just make it yours. These are great examples of that. The only thing we will ask is please don't edit the videos themselves because people appearing them did not agree to that. So if you need some edits for any reason, reach out, and we do have a mechanism for doing things like that, but please don't change the videos because they are approved as is. And then finally, some social media examples, and these are really just for fun. These are another example, another one from Baton Rouge, with a different doctor and a different message on PrEP, but still making local referrals and reinforcing the effectiveness with their copy. So you can imagine they're posting on PrEP, different messages, different videos, but then that underlining kind of 99%, and here's where you can go to get a hold of us. And they're just building out that series of posts. And then on the right, that's actually a U equals U message. We have some that are HIV prevention that talk about PrEP and U equals U. For those who don't know, this is Dr. Dimitri Daskalakis, who was heading HIV and then MPOX at CDC. He's now in charge of some other things at CDC. But he's part of the community, and you can see from an individual community advocate. And for those of you on the line who are here representing yourselves and are here out of the goodness of you doing you, the Positive Otter just shared Dr. Dimitri's video with an engaging caption that actually absolutely cues LGBTQ audience with Daddy Dimitri, right? So your own social media ambassadors can help with that kind of amplification too. You can provide a set of core messages or your own talking points. This is what we provide or how to get it, and guidelines, and then have them customize posts in their own voices, right? So we are greater than together. So taking these pieces and making it match our community. So I would just caution, be sure you have a review process so you make sure everything they put out is accurate. Remember, the first part of being trustworthy is having it be correct, and that it meets the other parameters we talked about today. Alrighty, closing out where to find all of this good stuff. So this is on YouTube, so youtube.com, and we are at Greater Than HIV is our channel, and you will find all the videos that I showed today and literally hundreds more. And by the way, this could be your takeaway, is to go to the YouTube channel and watch 2 videos. I bet you can come up with even more creative ideas, but I do encourage you to do that. So Greater Than HIV, no spaces. I think you'll find your way there. These are sort of our real people. You recognize Michael and Nicole in the lower right. You might even recognize Lux in the gray shirt from one of the images I showed earlier. But these are all here, and there are kind of longer versions in this playlist. If you like their energy of Brandon, you can also watch everybody that you saw today is in this kind of real people playlist. And then the next one I think is our medical experts. So this is where Dr. David lives. They're all on the same channel. They're just organized into different playlists. You can see some of the other healthcare providers. Dr. Charlene Flash is also part of the series. So if you're also, you can take a look at some of her messages. And I don't think he made it into this slide, but Dr. Leandro Mena is also one of our physician ambassadors, and he's a native Spanish speaker. So there's a Spanish playlist. Some of you might know him. He's a longtime LGBTQ sexual health leader, and he was recently head of STD prevention at CDC. So very credible, very engaging folks, and he happens to be a native Spanish speaker. So you can find all of this. This is actually a campaign we made with CDC with these. That's why we have 2 CDC representatives in the mix. And there is, for those of you that are in clinical settings, there's also a component of this series we call it peer-to-peer, so provider to provider, encouraging providers to prescribe PrEP. So if that's something you're working on, is getting your primary care folks or others to be prescribing who aren't, infectious disease docs and can absolutely write a script for PrEP, know that that's on the playlist too. And then finally, real quick, is the graphic designs, there's no blue people options. So 5 things to know about PrEP, one of the animations that we started out with. And then I think the last thing I have for you is just our webpage. So all the videos are on YouTube. There are also graphics you can download and videos you can download, so you can direct upload them onto Facebook. The website is greaterthan.org. And if you type /materials, greaterthan.org/materials, you'll find your way to our library. There's also a drop-down menu. You can find your way to the video and graphics library. You can download and use the filters actually in Spanish language to find. So I think there's an option to sort of do the tick box for Spanish. And then the filter, if we click on that, it just gives you an example. You can find them by the provider. That provider series is there. If you're looking for PrEP, if you're looking for Ryan White or MPOX or other information, that's all there too, the awareness days. So this is all free. We spend a lot of time and make it for you. So we would love for you to use it. So I'm going to end my time and look forward to all of your questions. Please stay connected. You can find us at Greater Than HIV on all the major social media channels, the website greaterthan.org, and you can find me at greaterthan@kff.org. If you wanted to sign up to test for National HIV Testing Day, June 27th, that's the way too. Thank you for the applause and support and attention. I hope you're not only in it for the raffle, but even if you were only in it for the raffle, I hope you learned something. And I don't know, Elena, we could kick it off with a question to you all. I want to pop in the chat. What are you all going to do as your one thing, your action step coming out of today? I'd love to know what resonated and how you're going to make Los Angeles greater than HIV.
So Robbyn, I do want to start out by saying thank you very much. That was a wonderful presentation. Typically, I'd have questions come up during the presentation, but it seemed like with each section, you kind of answered the question. And since I have access to you, I want to start with questions from the audience. So Elena, do you want to go ahead and share some of those questions?
Yeah, absolutely, Ron. And I just want to second the thanks to you, Robbyn. Fantastic presentation. And I think we're getting some great action steps coming in the chat right now from our audience. We did have a couple of questions come in as you were speaking. The first one was, how did you go about recruiting volunteers or potentially paid folks from the community to be models for your ads?
Yeah, great question. Usually we're recruiting in a specific place. So I mentioned we do a lot of health department partnerships. So sometimes that will drive where we're casting real people. I know we're talking about LA and there is an industry that you all work with. So it's really about putting out word of mouth. A lot of times we'll ask folks like you all, like, who do you know who are the champions who are already experienced, and comfortable speaking about. I think being informed is really important. And we have a process it's a first do no harm process, right? Like, is this person really in a good place to be put out there in a big way that is not going to jeopardize their, maybe because of their identities, like their workplace or their own health or, sort of any of those pieces. So generally the community knows. We'll often get referred to the same person by multiple folks, or we'll, meet them in our sort of our own networking. So if any of you are that person, I mentioned, we are looking to do some stories of folks who have taken the injectable option and what has that meant. It's been a little slow startup because not that many folks are on it. And we want it to be somebody who's like really in a sturdy position, right? Like everything, like socially, emotionally in a good space. Feel free to email us and it'd be great to be be in touch. I think particularly to get more messaging in Spanish would be super helpful for us. I think it can be difficult to disclose in communities that are more stigmatized or homophobic, transphobic, all of that. So.
Thank you so much. We have another, this is maybe a little bit more of a logistical question, but we have some organizations on the line that do, provide PrEP. Many of them do. And we had a question about how folks can have their organization updated on your website search for PrEP providers. Is there a way folks can go about doing that?
Yes, email us whatever your issue is, but the main directory that we link to on our website is the national resource that NPIN manages. So you have to get NPIN to change it. We can help reinforce that. We have sort of a back channel to do that, but I think when you go into the directory, there's an option to update a listing and you need to go through that process. How quickly that happens, I'm not sure. But let us know if there's an issue, if it's on that main like zip code, enter your zip code resource. And we can send a note to the folks that we know too. It's not our resource, so I can't update it directly myself. There are some times when we're doing a promotion for a specific place, we'll create a short list, like with that idea of, okay, if we're doing a trans focused campaign and we're going to curate a list, not send people to a national directory, but like, these are the 5 places to go that you're going to get treated well. We might make a web page for something like that. So if there's anything that's on greater than that's not in that national directory that needs to be updated, please let us know. It's greaterthan@kff.org.
Perfect. Thank you. I just have one other question over here, and then I'll turn it back over to you, Ron. This question, so of course, we, all of us on the line, I think, know long-acting injectable PrEP is the newest option. Communications still often focus a little bit more on pill-based PrEP at this time. So the question is, are there any unique things that we should keep in mind when messaging about long-acting injectable PrEP specifically that might kind of differ from how we've learned how to communicate about pill-based PrEP? I'm curious if you have any insights on that.
I think folks just want to know the basics of what's involved usually, right? So how often do I have to come? Where do I go to get it? The sort of how to get started, and what should I consider in my trade-offs, right? Like, you might want pills of this, you might want injectable of that, but here are your options, and making the best fit choice. And this would be a great one to open in the chat too. Like, what do you all hear in the community are the most important things to say about long-acting injectable? I would just caution, like, I know this whole initiative is about decreasing the amount of time it takes for long-acting injectable PrEP to reach really important communities, right? So we want to celebrate it and make sure that folks are informed. I'd be very careful about making it the more effective, the better, because it's still not available in a lot of places. And it is like part of why we aren't doing a lot of promoting of it is like, we need you all to build it to be able to offer it and have places we can send people reliably, not just that it's out there, but like, here's a place that you can get it. And folks have put into place which is amazing that this whole initiative is really helping to streamline and speed up that process so that the processes are in place, that the medication is in the office, that there's insurance sort of billing, all the pre-authorization stuff is sorted through, like all of the logistics that are a bit more complicated than, getting a much cheaper generic pill option that, I can go pick up at the pharmacy. So I'm just trying to see if folks have added into the chat. I see lots of I appreciate y'all taking my assignment. A+ to all of you for taking your next steps and sharing links with patients and other things. But it doesn't look like anybody's chiming in the chat of things that you all think are important. I think those basics again, it's medication. You need a prescription. How often I'm going to have to go get it? How well does it work? Who's it for? And then how does it make you feel? Like, why would you do this thing where it's like, it's a hassle to go to an appointment every 2 months? How long am I going to have to wait? Is it really free or is covered? Like, is there copay? What if I'm not insured? What are my options?
Yeah, thank you so much. And we did just get one comment in the chat saying one of the challenges of promoting injectable PrEP is that there are still some of those kind of major logistical issues for many people and providers, depending on where you are. So just kind of affirming that piece of what you shared, Robbyn. Well, Ron, I can pass it over to you for any additional questions.
Okay, thank you. Yeah, I was thinking with your last comment, I was thinking about how, with this particular initiative, we really were trying to sort of preemptively and proactively get information out on an innovation, HIV innovation, which usually doesn't get to these populations. But there's also that fine balance between, is it accessible to these populations? But I think through this initiative, we've seen more community organizations, more clinics sort of, proactively become involved and sort of preparing for the implementation piece, which I think might happen quicker than it would have with PrEP in terms of getting to these populations. So we're keeping our fingers crossed that it does continue to move forward in that manner. I did have, like I said, you answered most of my questions, but I did have one question, and I'm not sure if there's an answer but is there a lifespan or shelf life for some of these ads? And how do you know when, okay, we need a new one?
Some things get outdated, information gets outdated, right? So it used to, I think U equals U, right, is like there's no risk anymore, is the language. The science caught up with that. It used to be 96% reduction of risk. I don't know if you remember that number of treatment as prevention, until, I don't know, 8 years ago or whenever the Partner 2 study was. So like we try to be careful about stats that change, and sometimes we will include them. I think generally it's difficult for folks to the math doesn't always land the way you expect it to land, right? Like it can be confusing, but stats tend to change. So that's key. You saw a whole bunch of billboards that said PrEP is pill to prevent HIV. It is still a pill to prevent HIV. It is now also an injectable option. So depending if we're promoting for a clinic that only has a pill option and isn't able to provide injectable yet, or there's some telehealth programs that we partner with that you can't give an injection through the Zoom, right? So that's a limitation. So when it is a pill and they are offering a pill, we'll do that. But we've tried in as many places as possible to update the sort of offering the shot option too. And, sometimes circumstances for the individual's picture change or other things will shift, but it's interesting, like we've been doing this for a long time,
Right.
and a lot of it still holds up.
Yeah, because I know I've known David Mailbranch since when he was really, really young. So it's nice to see the videos. And so I was wondering, it's like, how long is he going to last in that phase where are we going to be looking for other faces that also represent the community? But
we're always looking for other faces and then opportunities. So, like everybody else, we have limited budgets and time and resources. So the sort of reality of getting a shoot put together, but we are talking about sort of our next round of messaging and planning to film something later this year. So if anybody can hear my voice who thinks they might be a good candidate, or they know either a healthcare worker, doesn't have to be an MD, but or community member who, not that you can't be both, who you think would be a good candidate, have them get in touch with us. Best for them to self-nominate, and we'd be really glad to know of your interest. And then if it works out to shoot in LA or to bring somebody to where we're shooting, that would be amazing.
Great. I hope everyone's listening to that or heard that. We would love to have LA representatives in these videos. So that was my only real question. So I do want to make sure that we have time to get to these raffles, because we have 3 lucky people that are going to walk away right now with a $50 gift card. Oh, no, we're doing the evaluations first. So people still have to hold on. Sorry about that. So Omar, do you want to, or Elena, do you want to share the evaluation slide? putting the link in the chat. Okay, so Elena has put the link into the chat, and we will give you just a few minutes to go ahead and complete the evaluation. As I mentioned, if you complete the evaluation, you will be entered to another raffle for an additional opportunity. If you completed the evaluation, sit back and enjoy the stay on because you could win $1. Right, Omar, can you go ahead and stop the music? People can continue to work on the evaluation if you haven't completed it. But while you're doing that, Elena is going to give us the 3 names that were selected for staying on till the very end.
Yes, so our first winner is W. David Hardy.
Congratulations, David Hardy.
And our second winner is Jasmine Wells.
Yay, Jasmine.
And our third winner is John Blasco.
Congratulations, John. So what do they need to do? Just respond in the chat?
Yes, so we do have their emails. It looks like they are all still on the line with us. So we have their emails from registration and we'll be sending your gift cards along after the webinar. Congratulations.
So we have 3 very lucky people, richer people. But that doesn't mean that the rest of you don't have an opportunity. Everyone that completed the evaluation, and if you didn't complete it, you still have an opportunity to do it after the workshop's done. Everyone that completes the evaluation will be entered into another raffle on Friday, where we will select 3 additional people to win a $50, to each win a $50 gift card. All right, let's go ahead and wrap this up. Next slide, please. So just some closing remarks. We want to thank you for attending the 5th workshop on LAI PrEP here in Los Angeles County. We will be offering 2 additional workshops over the next 6 months. One we do have sort of that we're formulating, which is to look at workshop on having people who are actually using injectable PrEP talk about the lived experiences of themselves using LAI PrEP. We will hear about the challenges and benefits of using this newest HIV prevention, particularly around by Latino, Latina, Black MSM, and transgender women who are using PrEP. In addition, you can make suggestions to us of what topics you would like to see around injectable PrEP that are relevant to our priority populations. There's an option to include that in the evaluation at the very end. But other than that, I will give you 2 minutes back. So thank you, everyone. Thank you to my team. I see Omar coming on, Elena, and especially thank you to our
joining
speaker.
us today. Thanks for having me.
Thank you very much, Robbyn. Bye, everyone.